Well, as you've probably heard by now, Senator John McCain has been diagnosed with brain cancer. His family members first made the announcement yesterday.
Joining us to talk more about his condition, Dr. Vik Udami, Medical Director of Neuro-oncology at Sharp Healthcare. Dr. Udani, thank you so much for being here. As far as brain cancers go, this is really one of the more common but also more aggressive types, right?
That's right. This is the most aggressive when it comes to tumors in the brain. We use the World Health Organization classification on a scale of 1, 2, 3, or 4, 4 being the most aggressive. Glioblastomas are grade 4 tumors.
Senator McCain had a blood clot over his eye. Is there a connection between that and this type of brain tumor?
So basically the reason he had the clot is because the tumor bled. So these tumors grow quickly, and if they outgrow their blood supply quickly enough, they can hemorrhage. And that's what happened with Senator McCain.
We heard a tweet from McCain today saying he was going to fight, and to his foes in the legislature, if you will, that he would be back. What are the treatment options for this, and is it something that he can continue to serve as senator while doing?
So the first step is surgical resection, where we try to remove as much of the tumor as we safely can. In his case, the tumor was in the frontal lobe, and that's a portion of the brain that we can go into. From what I've seen and read, it sounds like he had a thorough resection. He was fortunate that they were able to do it through a little incision just above his eyebrow, so it was what we would call a minimally invasive type of surgery. From here on out, once he recovers from the surgery in a few weeks, he'll need to start chemotherapy and radiation, and from there on, he'll need to get scans of his brain every 2 to 3 months to look for any recurrence.
Senator McCain has had skin cancer in the past, at least on 3 separate occasions. Is there any link to the form of skin cancer that he had to the brain cancer that he now has?
No, unfortunately, he falls into that group of patients that have had 2 different types of cancers in his lifetime. So the glioblastoma is not related to the melanoma. The melanoma is something that started and stayed outside his brain, whereas the glioblastoma is what we call a primary brain tumor, so that started within his brain itself.
We also know this is the same type of brain cancer that Senator Kennedy had, as well as Joe Biden's son. Their prognosis, over a year, close to 2 years for some. What is the typical amount of time that you usually see people able to survive? Because it's an incurable cancer.
That's right. As of today, it is not curable. The mean survival is 14 months, so that means that half of patients live less than that and half live longer. Up to about 10% can survive 5 years. That's rare in patients as they get older, but there certainly is hope.
All right, some excellent information for us, Dr. Udani. Thank you for being with us today.
My pleasure.